Hello, everyone. My name is Rose Gerber. I'm the Director of Patient Advocacy and Education for the Community Oncology Alliance, commonly known as COA. I hope you're all doing great. I want to wish you a happy fall. I happen to live in New England, and when the leaves start to change colors, it's really spectacular up here. And I think cancer survivorship, it's all about noting the seasons and making note of it and just realizing how lucky we are all to be together today. I'm anxious to tell you about today's agenda. So if I can get to the next slide and our special guest, Stacy Lewis, who you'll get to hear more from in just a few minutes. So today I'll do what I always do. I start off with some big important national updates. And what I want to begin with is not only is COA, we're very proud of the work we do, but we're also very proud of the attention that we draw to other organizations that are also doing great work. And today, the American Association of Cancer Research, AACR, who I know many advocates are also very active with, released their cancer progress report. And I've just done the preliminary overview, and it has, as usual, some really great information. And while the report is primarily focused on cancer research, what they did very well is they included patient stories and information on a very topical and ongoing topic, and that is health disparities. And today our special guest is going to touch briefly on health disparities as well. So again, we just like to keep you posted on what's continually at the top of the national oncology issues. And in other important news, something that we've talked about several times on our advocacy chats, and for those of you who follow COA News, get our newsletters, visit our website, is the ongoing COVID limbo. And I don't know where I read that phrase, but I thought it was a perfect description of what we're all continuing in our personal lives and our professional lives to live through. And sadly, the impact of the decrease in screening during COVID is continuing to be an issue. And a very prominent publication, the Washington Post this week, did a great article where patient stories were featured. And I want to give a special shout out and thank you to these patients who have the trust in their physicians. Two of these physicians, Dr. Kasha Patel, who many of you know is our COA board president and a practicing medical oncologist in Rocky Hill, South Carolina, and the incredible also Dr. Deborah Pat, Texas Oncology. Their patients shared stories in this important article. So I think if you want to learn more about it, I encourage you to visit our website. You'll find the article there, just Google it, and you'll see the pictures of these amazing patients and you'll hear their stories. And I always like to thank the patients because that's what every organization says it is the most important thing is the patient focus. Now, today's special guest, let me take one step back. So hopefully we all know that this month is Breast Cancer Awareness Month. And breast cancer is a disease that has definitely gotten a lot of media attention over the years. Even within the advocacy community, there's a lot of other advocacy groups that think breast cancer gets too much attention. And one of the reasons for that is that the advocates within breast cancer, both the male and the female advocates, are very, very vocal. So a special, again, thanks to all the cancer advocates that are involved and continue to be involved in breast cancer awareness. Before I started working in the cancer care oncology space, because now that's my personal and professional focus, is making sure that patients have access to affordable, high quality care, which community oncology practices provide. I was very, very active in the breast cancer space. I'm a long-term breast cancer survivor, and I was also a young breast cancer survivor when I was diagnosed. And it was during this time that I met the incredible Stacy Lewis, our very special guest today. And she's exactly the kind of person that I have true admiration for, that she has walked the talk, she does the work, she works really hard. She's a long-term leader in the advocacy space. I'm so happy to have this incredible, talented woman with us today. And Stacy, I welcome you to tell us everything that you would like us to know about your wonderful organization. And it is all yours now, Stacy. Thank you.
Rose, I can't thank you enough for those kind words, for the invitation to both me personally and to Young Survival Coalition. It is my honor to be here. It is such a privilege to finally get to work with you after knowing each other and passing each other in some rather large hallways over the years. So thank you again to you and to COA for inviting YSC. As Rose said, I am Stacy Lewis, Chief Program Officer and Deputy Chief Executive at Young Survival Coalition. It is my honor to be here. Let's go to the next slide. And I think that we know it is Breast Cancer Awareness Month, and yet the numbers that you're looking at indicate that it is likely that we are all aware. We're all aware that breast cancer is a devastating disease. We're all aware that it is the second most common cancer killer in women in particular. But as you can see, it also impacts men. And we're looking at almost 45,000 deaths annually. And I think it's critical to acknowledge that. And we'll talk a little bit about the disparities that we're seeing in breast cancer. To Rose's point, Young Survival Coalition is very focused on the young adult population. So while you'll hear me really focus on that population, certainly the issue is large and looming. Let's go to the next slide, please.
Stacy, just real quick, I have to commend you for being brave enough, and I say brave, to actually put the number of deaths on your first slide, because something that I think is very, very sad, like it is literally gut wrenching to me, where I've like physically sobbed, is that because breast cancer is so commonly diagnosed, that when women or men are diagnosed with breast cancer and they're reaching out to their inner circle for
Mm-hmm.
support, oftentimes they just get oh, you'll be fine, everybody survives cancer. But nobody realizes the people that working in breast cancer, and those of us that are survivors know, that's a staggering amount of deaths per year, staggering. And it's, we like to bring you all the truth here at COA. So thank you. And hopefully you can tell us more about today's event and what your organization is doing.
Absolutely, and I appreciate you jumping in there because what's important is on this day, October 13th, today is Metastatic Breast Cancer Awareness Day. And so those almost 45,000 people are not dying of breast cancer, they're dying of metastatic breast cancer that has spread to different parts of their body and ultimately have caused them their life. And so I think it is important to acknowledge Metastatic Breast Cancer Awareness Day. Young Survival Coalition is a founding member of the Metastatic Breast Cancer Alliance, where there are multiple organizations, industry partners, and individuals working together to combat metastatic breast cancer, to amplify the voice and to make a difference. So being here on this day does feel very special. And so thank you again. Let's go to the next slide. So a little bit about Young Survival Coalition. You can see our vision is one where no young adult faces breast cancer alone. And you can imagine many have been through some devastating things, and Rose, as a young breast cancer survivor herself, can immediately, I'm sure, reflect on that moment that she was told she was diagnosed with breast cancer, and probably going into many treatment centers and environments where there were a lot of older, primarily women. And so for Young Survival Coalition, over the last almost 23 years, we've been solely focused on meeting the needs of the young adult population dealing with a breast cancer diagnosis. So that includes survivors, meta-thrivers, those living with metastatic breast cancer, and their co-survivors, the community of their supporters, their friends, their family, because they all are walking through this journey with that survivor. So that's Young Survival Coalition. Let's go to the next slide, please. We talked a little bit about health inequities, and Rose mentioned the AACR report, which I very much look forward to reading, because they're doing some really great work over there, in particular around disparities and inequities. And in the young adult population, the incidence of breast cancer in young, primarily African American women is certainly one where they're being diagnosed at later stages with more aggressive breast cancer than even their white counterparts. And young adults in general are often diagnosed with more aggressive breast cancers. And you can see on this slide that there are some various nuances, many of which unfortunately will not be combated until we really deal with some systemic change. Systemic change in our healthcare, some systemic change in the way the healthcare industry interacts with this patient community, and some systemic change in the way the patient voice is really amplified and incorporated. And at Young Survival Coalition, we're really trying to amplify the voice of the young adult community and ensure that the disparities and the health inequities are heard even as researchers are designing protocols and as clinical trials are moving forward, because it is so important that we understand why these disparities exist, whether it's biology, social determinants of health, whatever the reason, we want to be able to address the issues that our constituents are facing. And until we deal with that systemic change, you know, YSC and many other great organizations out there will continue to make the incremental progress needed to serve our community. Let's go to the next slide, please.
Stacy,
Yes,
before you advance, I really you
please.
used the word systemic several times, and I think that's really critical, because when people are just looking back to the last year, that's when the inequity conversation really was forced to the top of the national conversation, whether it was in oncology, cancer care, anything. But it isn't a quick fix. And this is what is going to change is a system. It's not just a press release. It's just not a public statement. It's just not a feel good podcast. And it's really going out to the right communities. So I think we should all write down that word and that phrase, systemic change, because we all need to ask ourselves, like, a lot of times it's not the person. A person could be a more involved activist. It's the system. Organizations need to look at how they're functioning, because a lot of times when there's a criticism aimed like, well, why don't Black women or Asian women or Hispanic women or the gay and lesbian community, why don't they do more? They're doing a lot more. The system needs to change. So systemic, very important. Thank you.
I appreciate you amplifying that, because it's not only systemic, it's also not new. So at
Not new.
YSC, you know, we developed a number of years ago a diversity and inclusion and health equities roadmap so that we can really begin to, you know, in our small sphere, really make more meaningful difference. And at the same time, these issues of health inequities and the systemic issues are not new.
Right.
But it really does take all of us, and I really do mean all of us, at the policy level, at the healthcare level, and even at the patient and health literacy level.
Yes.
It really will take all of us to make a difference in what we're seeing in the disparities, in the mortality, and ultimately in the incidents. So thank you for bringing that out, Rose. Next slide, please. All right, let's go to the next slide. So for Young Survival Coalition, we have a number of initiatives that we are focused on really to strengthen and empower the community that we serve. So we certainly focus extensively on education and making sure that the communities within our community have tailored information delivered to them in ways that they can consume. So yes, it is a multi-pronged approach. We move from our website to live streams to a navigator series. There are a multitude of ways that we strive to deliver education to our community to ensure that they can then work in a more active way with their healthcare providers and really take as much control as possible in managing their health. And Rose, it looked like you were going to ask a question.
Yes, I'm actively listening, but this is prompting so many good questions. Stacy, can you help our audience understand the difference between how I'm looking at the guide for the newly diagnosed, and then I'm thinking back to your intro slide on metastatic breast cancer. Help our audience understand how those needs are completely different between someone who's newly diagnosed, because when we think about metastatic disease, we always think about the cancer advance, but some newly diagnosed patients are metastatic at the time. So those, again, breast cancer, excuse the description, gets lumped together. And there's many different types of breast cancer, and the breast cancer experience for someone who's newly diagnosed, for example, with DCIS, ductal carcinoma in situ, versus a metastatic breast cancer. Talk to us about that and how you meet those needs of those differing patient groups.
It's again a great question, Rose, because the needs are so very different. And I think that we can all put ourselves in a position where we've fallen and scraped our knee, and we know that that there's pain, that there's blood, yet there's healing. And when our leg is broken, there's a different level of impact. And when our leg needs to be amputated, there's an even higher level of impact. And so, while a very poor analogy, the reality is that those diagnosed at early stage disease are still given the information. Certainly, we hope that they have great access to quality care and are then on a trajectory which says you're going to go through this treatment, and then hopefully we'll be able to identify you as NED, or no evidence of disease. Whereas those diagnosed with metastatic breast cancer know at the very beginning that they are going to be actively in some form of treatment for the rest of their life. So they will be addressing their breast cancer, living with a sense of uncertainty, knowing that some treatments will work, some treatments will work for a little while, and some treatments will then not work for them, and therefore they'll have to look for yet another treatment. So the experience is totally different. And looking at the population of young adults, knowing that, if you know you're going to have 6 rounds of chemo and you have 3 children at home, you can see a different light at the end of the tunnel, so to speak. Yet I'm so honored to know so many young women living with metastatic breast cancer that are living standing on a sense of hope, knowing that as they raise these children and as they live their lives, that they're working hand in hand with the research community to strive to find the right treatment for them, the right treatment for people like them diagnosed with a similar type of breast cancer, and the treatment that will extend their life with quality. So they're really 2 different trajectories and experiences, yet the devastation of the diagnosis is the same. Young adults are not supposed to get cancer, and they're not supposed to get breast cancer. And this devastation is something that YSC is really looking to address, not just at the initial diagnosis, but throughout each individual's experience with life as someone that has been diagnosed with breast cancer.
Thank you, Stacy.
Absolutely. Next slide, please. Oh, you could probably jump another slide. I think that Rose can likely attest to the fact that most young adults dealing with a diagnosis of cancer need support. They need support, they need community, and YSC really looks again at a multi-pronged approach to deliver supportive services to the community of young adults dealing with breast cancer. And I mentioned those co-survivors. So you can see in this slide, we offer a multitude of virtual hangouts, which can be considered online support groups. And it is important that each unique community be given the opportunity to meet others in their unique community and really talk about what their needs are, and to support each other. And so YSC looks to provide those platforms on an ongoing basis.
Stacy, and kudos to your organization, especially. I want to zone in on the co-survivors mill because,
Sure.
again, I've shared my story several times. And, my husband, I was extremely by choice, very, very private. I didn't want anybody to say anything to my very young children. But what I did learn over the years, once I was out of my, my most saddest times in my life, is that the men in particular, whether the men of breast cancer patients, they really don't have any kind of support group because they're even more private than women, just in general. So the fact that you're doing these virtual hangouts or online for these different groups, the gay community, how exactly do they work? Is it like a Zoom call? Is it like a conference call? Are they seeing faces? How does it work?
So it's a great question, and the co-survivor population, I will say, is extremely important to us, right? Just as when you're on a plane, they say you put your mask on first, and then you go to help the other person. And co-survivors need to be given permission and be empowered to put their mask on first, to really understand how to strengthen themselves so that they can support their loved one, the survivor. And so our virtual hangout series, yes, they are primarily Zoom meetings.
Okay.
They are private. So you have to register, etc. Certainly don't want any interlopers in any of the groups. But
Right.
the idea there is cameras are preferred, but not mandatory, because to your
Good.
point, some people are still very
Very
private,
private.
yet
Right.
they want that opportunity to hear and be supported and give support. And so we look to provide these in a really unique way, and have the opportunity to support them not only through the virtual hangout program, but into our private Facebook community, which is segmented in a very similar way. As well as into our in-person programs, like our summit, where there is that opportunity for networking. I will say that there's a lot of needs in these diverse communities, and in particular in the LGBTQ population. Really, we need to collectively amplify their needs and ensure that those needs are being met, whether it's through YSC in collaboration with others, through their healthcare provider, etc. So it is
Fantastic
important work.
resource. We'll be all help share this. It's a great resource, Stacy. Wonderful.
Great, absolutely. Let's go to the next slide. Building community is very important to us. We could go to the next slide. And I think that during this time of the pandemic, which unfortunately we're still in, we acknowledge that the sense of isolation caused by breast cancer diagnosis at a young age, compounded with coronavirus and the isolation, the social distancing, etc., has had a significant impact on our community. And so we've looked to really innovate. We offer about 100 face-to-face networks across the country. Many of them moved into Facebook or online platforms during the pandemic. And as you can see in some of these great pictures, they're starting to reconnect again in person. It is important that people start to find their tribe, right? Start to build their community locally when they have the opportunity to do so. And when they don't, certainly through our virtual hangouts, which I mentioned, as well as our summit, which of course this year was virtual, and some of the other programs that we look to deliver. The design really is to understand the community needs and to meet those needs where those people are. And so this is really just a brief overview of some of the work that we're doing to ensure that we are creating community where they're supporting each other locally.
Yeah, and the word the isolation, Stacy, we've heard that so much. And as you know, COA, we're not a cancer specific group, so we do
Mhm.
work with cancer survivors of all types. And that really is one of the saddest things right now, to be a newly diagnosed patient, because for those people who choose to be open and ready about it, they do crave connection and an understanding for someone who is going what they're going through. And that you've segmented all these groups is really incredible. And I want to just pause for a quick second. We did get a question from one of our nurse navigators, a wonderful nurse that is also one of our CPAN chapter leaders, and just asked if you could explain how you define a young survivor.
It's a question that comes up all the time. So thank you to the Nurse Navigator for asking that question. YSC was founded by three women that were all diagnosed under the age of 35. And at that time, the screening programs all referenced those diagnosed at 40 and over. So traditionally, YSC is there for those diagnosed at 40 and younger, yet we do not card. So if indeed someone is diagnosed at 42, at 47, and they feel a kinship, so to speak, with Young Survival Coalition, that's why we're here. You know, some have young children at an older age, and they feel that connection with other young mothers or mothers of young children, and so YSC is here for them. So traditionally, it is 40 and younger, and we won't card. So if you want to come to our summit or visit some of our programs, please know that they are welcome as well.
Thank you, and thanks for your humor too. We all need to laugh
Absolutely.
more. I need to laugh more, I'm told. So
Well, I gotta say, laughter, I think, is what is allowed. I'm sure you can resonate. It's what has allowed us to stay in this
that's
field
true.
for so long. Let's go to what I believe is the last slide. I did want to talk just a little bit about one of our most exciting projects, and we're calling that Project 528. And Project 528 is our attempt to embark upon a global needs assessment to address or better understand the needs of the 528,000 young adults living with a history of breast cancer. And so be on the lookout for more information. Anyone that is interested in more information is welcome to write to Young Survival Coalition. You can write to me. My contact information will be on the last slide. Yet the reality is that we want to be able to identify these needs globally so that we can share the data with anyone and everyone that is interested in meeting the needs of the young adult population worldwide. So that is Project 528. Yes, ma'am.
Sorry. I was excited too again about walking the talk, and kudos again to your organization that even this picture shows that you do work with such a diverse population. From this young, very cool, hip, trendy female to the mother with a baby. The need, again, breast cancer sounds like one diagnosis affecting everybody the same. But the fact that you even included a male, the needs are very different. So anybody who wants to learn more, I really encourage you to go to the Young Survival Coalition website, which I think is fantastic. You all do a really great job with so many resources that I may be borrowing and publicly acknowledging. I'm very good with giving credit where it's due. So I'll say I got this idea from YSC and from Miss Stacy. Okay,
Well, I can't appreciate that enough, Rose. Let's go to the last slide because that will make sure that everyone has the information that they need to get in touch with YSC. I am truly, on behalf of YSC, humbled by this opportunity to talk to the COA community. I think collaboration is key, and the majority of our community is being treated in their community. So knowing that we can build this alliance, we can continue to work together, and knowing that the COA community knows YSC is there as a resource is so dear to us. So thank you again, Rose. Thank you so
thank
much.
you, Stacy. You did a terrific job. I really appreciate it. And I hope that we do run into each other in big, important hallways or our home offices, anywhere on Zoom. We're really grateful for your time today. And I'm also very grateful for all of our audience members that continue to participate. And we will have this information, this webinar available on our website, usually within like a day or two. And if I could have our wonderful communications expert, Drew Lovejoy, who's in the background, go to the last slide, we will wrap it up. So we like to keep you informed, not just about our topics, but other topics. So since we're on the advocacy chat, I'll draw your attention to the far right. I'm really excited about next month's guest, Aubrey Kelson, who is a social worker. She's also one of our CPAN chapter advocacy leaders. She's in Washington, Northwest Medical Specialty. She does a terrific job as a CPAN leader, as a social worker. And this also continues one of our little sub-series within the advocacy chats, which is getting to know your oncology care team. And the last time we did that, we featured Brenda McGarr, one of our CPAN chapter leaders out of Augusta Oncology, and we got incredible feedback on that. So I'm sure you're going to learn just as much from Abra, who's an incredible social worker. And then we also draw your attention to the left now. Before our advocacy chat, we're doing a special advocacy briefing on November 1st, and it's on the 340B drug pricing program. Now you might go, what the heck is 340B? This is a program that had good intentions when it was first formed. It was supposed to help patients, but now it's ending up costing patients. So this might be out of the scope of what you're generally tuned into, but you'll find it very, very interesting. We have our executive director, Ted Okon, who you're always telling me you think he's a great speaker, and I agree. And Dr. Feldman, who will be talking about this. And if you didn't get an invitation, please reach out to me at roseg@coacancer.org or to my assistant, Tracy Banks. And thank you all for being with us today. And I will see you twice next month. Thank you for being with us. Enjoy the rest of your day.